Hi, this is Dr. G, your Arthro guy, fellowship-trained orthopedic surgeon specializing in your hip and your knee replacement. Today I'm going to talk about 5 things that you can do to improve pain and swelling after joint replacement. As you know, hip and knee replacement can be very painful, especially knee replacement. It goes through into the sort of a vicious cycles of more inflammation and pain. So there are things that we can do to prevent from this vicious cycle to go unchecked. So I'd like to give these 5 recommendations to you to improve pain and swelling. First, elevate your leg and ice it. That's very simple, right? After the surgery, especially in the first 2 weeks, I would suggest ice it aggressively. What does that mean? I don't want you to ice it too aggressively to the point you're going to have a frostbite. I want you to ice it maybe 20 minutes and take a rest for about 40 minutes to an hour and come back and do it. You can do that over and over again when you're awake, and then even when you're asleep. Your sleep cycle might be disturbed as well too, so you might not be able to sleep 8 hours straight. So you might wake up in the middle of the night. If you think about it, you can put ice on for 20 minutes and get rid of it and rest for 40 minutes to an hour. And when you're resting, I want you to elevate your leg above your heart. Your heart is right around here. So when you're sitting, it's really hard to get your leg up. So you want to probably use a recliner, or when you're lying down flat, get the leg up as high as you can so that the gravity does a job for you to bring the fluid back to your heart, or at least prevent gravity pulling the fluid down to your leg. And if you do have some spare money, or if you have someone that already purchased ice machine, a lot of my patients love this machine. You can go through Amazon or other places to purchase it. Second thing, it's easier said than done, is but leading a lifestyle that is healthy for you, consisting of a good diet, exercises including PT, no smoking, not doing any recreational drugs, and not drinking. You see, drugs, smoking, alcohol can lead to more inflammation. And more inflammation can cause more swelling and pain with that. So try to resist smoking and drinking, especially in the first 2 weeks after the surgery. I always tell my patients, especially the patients who smoke and they're not willing to quit, I tell them to quit at least for a month for me. I would not do a surgery if you smoke even one within this period. 2 weeks before the surgery and after the surgery. Not only is it going to help with your recovery and preventing infection, but it can also help with the swelling and pain after the surgery. Another aspect of healthy lifestyle is to have healthy diet. And you don't want to have any diet that leads to higher inflammation state, meaning that red meat, any high sodium food that you like, processed food, can lead to inflammation in your body. So try to stick with perhaps Mediterranean food, vegetarian food with low salt, so that you can have less of inflammation. Also, there are other food that are known as anti-inflammatory. There are a lot of fruits like blueberry, raspberry, or any berries. So try to stick with those diets as much as you can in the first 2 weeks, or even before the surgeries too, to prepare your body for it as well. Third thing is, this is what I call it, do it, but don't overdo it. If you overdo the exercises or walking too much, you can compromise the structures that are recovering, but not only that, you can also lead to more inflammation and swelling, not giving enough chance for your body to heal. But at the same time, you don't want to be sedentary. You don't want to be sitting around not doing anything and let all the chemicals and inflammatory cells to linger around surgical area to lead to more inflammation. So how do we find the right balance? I always tell my patients to walk around every hour or so, even if it's just going to the refrigerator, getting a drink, or just going in front of a TV, turn on the TV and go back. You might want to count how many steps you take. In the first week, I don't want you to do no more than 750 steps. And in the second week, I don't want you to do more than 1,200 steps. The more you do, sometimes can lead to more problem. Your physical therapist will guide you in the first 2 weeks how to go about doing the exercises and the motion that leads to it. Motion can be good, that can lead to better circulation, because your lymphatic system, which is a system that allows the fluid to return to your heart, is already compromised in this early state of recovery. Function needs to be compensated for by having the muscles move the fluid back into your heart. That can lead to better swelling control and better pain control. And also too, there's another benefit of that, which is to prevent blood clot. So I want you to be active, but not too active. There are a lot of patients out there, they'll be like, well, I don't have a lot of pain, so I'm gonna go walk around a few blocks. I've seen so many of the patients regress due to overactivity. So I would like to caution you against that. 4, supplementation. There are 2 promising supplements that I like to discuss with you. One is amino acid. Amino acid that is taken weeks before and continue with a couple of weeks of treatment with supplementation can be very helpful in terms of muscle recovery. Try to supplement it with your diet. Try to have high, healthy protein in your diet a few weeks before and continue that for a few weeks during your recovery in order to help with wound healing, with muscle recovery, and pain and swelling control. Second supplement that is less known is it's called MPFF of Diosmin. MPFF stands for micronized purified flavonoid fraction. This material has been used for lymphedema, for swelling control. There has been a recent study, as you can see from here, that by taking this as supplementation in the early stage of a recovery, patient was known to have less swelling after the surgery. But this is something that you can actually take even before the surgery and continue on for a few weeks to take that. I need to delve into this a little bit further for myself too, because this is a less commonly talked about in a new field that I need to delve into it more, so stay tuned for that. Finally, 5th recommendation to control your pain after the surgery is to comply or take the medications that are recommended by surgeons. This pertains to my patients more specifically. I give a lot of medications to try to control the pain for the patients. It's called a multimodal pain management. We understand pain pathway better than ever before. We understand that there's a pathway of a nerve. There's a pathway that there's a muscle. The muscle goes through the spasm. There's also inflammation, which I talked about. Then also your brain senses the pain. So we can target each part to allow for better recovery. I do give a lot of medications. And this is my regimen, and I'm sure a lot of us surgeons have different ways to do a multimodal pain medications, but this is specifically what I do. If you are younger than 75, I'll try to give the medications. Take it as prescribed, it's not as needed. I want you to take it for first 2 weeks. First medication, gabapentin. It controls nerve excitation. Gabapentin I give 100 milligram in the morning and 300 milligram in the evening. The reason why I make it different is because gabapentin can make you drowsy. So in the morning, I want you to take it a little bit less. And in the evening, if it can make it drowsy, good for you because you can get better sleep afterward. Muscle relaxant, I give it in the form of a Flexeril usually. 5 milligram twice a day, morning and evening. Take it. It can help with the muscle relaxant, especially for knee replacement. I give anti-inflammatory medication in the form of either Mobic or Celebrex. I want you to take it around the clock. that can help with bringing the inflammation down. Tylenol, I want you to take it 3,000 milligram to 4,000 milligram throughout the day. I want you to take it for 2 weeks. It can help with a pain control, probably more than any other medications you might know. And you might think that Tylenol does not help, but it surely does. I will also give some narcotics, tramadol and oxycodone, but those medications you can take it as needed. Because I give so many medications, you might have upset GI symptoms. So I do give PPI medications to help protect your bowel. Also, side effects of narcotics and all these medications relates to not able to go, meaning you cannot poop. So I give another medication to help with you pooping. What if you're 75 and older or allergic to some of the medications that is discussed about? We got to find other ways to control your pain. I might take gabapentin away from you. I might take away Flexeril because it can really interfere with your cognition and mental status. I don't want you to fall. So I'm going to avoid those medications as much as possible if you're 75 and above. So those are the 5 tips that I have for you to control pain and swelling through the surgeries. First, elevate and ice. Second, healthy lifestyles, including healthy diet, no smoking, no drinking. Third, do it, but don't overdo it. Fourth, supplementation, including amino acids and MPFF. Fifth, take the medications as prescribed. If you do have any questions and concerns, please leave a comment. Thank you so much for watching the video, and stay tuned for next episode talking about exercises that you should not and should do after knee and hip replacement. Thank you so much. Take care. Bye-bye.